This is the frontal chest rentgenogram of a hypertensive patient who suddenly developed tachypnea. Note that the heart is enlarged at the expense of the left ventricle, and observe an area of hyperlucency in the middle third of the right lung with a slight proximal enlargement of the pulmonary artery. The top right and the top bottom image is from a pulmonary angiogram. There were elevated pressures in the pulmonary artery. Note a saddle thrombus in the bifurcation of the right pulmonary artery. This explains the pulmonary oligemia. The bottom left image is from a retrograde inferior vena cavogram. Note reflux of contrast into iliac veins, but the hypogastric vein, particularly on the right side, had a beaded appearance. In this way, we established the origin of the pulmonary embolus. This lady had had a pelvic operation some weeks before, and she developed a pelvic vein thrombophlebitis. And the pulmonary emboli then arose from pelvic veins, not from veins of the lower extremities. When we finish our angiographic examination of the pulmonary circulation, we may drop the catheter to the level of the inferior vena cava, make a retrograde injection. And if the cava is free of thrombi, we can then advance the catheter to the bifurcation of the cava and do a retrograde injection. This is when we suspect that the source of emboli may not come from the veins of the lower extremities.